work. Now, let me give you some examples of issues in the health care situation. And actually, I think healthcare will probably not be part of our examples to work on, but it's good to. So, let's look at a typical disease that's increasing in numbers, which is Alzheimer's disease. You are aware that it's there, and actually in the UK, again, UK provides me with most of the examples because they worked it out. There are now 750,000 people who are diagnosed with Alzheimer, but they can predict that at 2050 there might be 2 million of them in the UK alone. So it's really a growing problem. By the way, do you know why this is growing so much? It's not just for people drinking too much grappa. There's other reasons behind it.
Because the number of old people is growing up.
Yeah, so people live longer, and a lot of diseases are now much better to be treated. So people won't die so easily from heart failure or from cancer anymore. People just will grow and live longer. And well, that's a good cause for why Alzheimer will be a bigger and bigger challenge for the medical domain. So, now some key challenges that the UK actually did this exercise. They identified key challenges. So, a big thing is social isolation. People who get Alzheimer, first of all, it's more difficult for them to keep up with social life because they forget appointments, they forget why am I here, maybe I don't remember exactly. Also other people think, oops, this is a funny person, he tells me the story 3 times, so I don't like to visit him anymore. And so people kind of withdraw. And also the persons that take care for the Alzheimer, which could be their spouses, their partners or their children, they find out they are getting isolated. This is really a challenge. And and another thing is that many people are not aware of the fact that once somebody is diagnosed with Alzheimer, it's considered that this person could not handle his own duties anymore. So he's getting a stigma. He is kind of, well, they don't let him do things that he still could do. They don't trust him as a responsible person anymore, even if maybe in the first phases it's just a memory issue. And it's difficult to find the right support. And this is definitely not only the case for the UK, but I think in many countries. Again, I'm aware of in my country, if you have a member of the family who's got Alzheimer, then it's difficult to find out where you can get the right ways to support, to find somebody who takes care, sometimes to find locations where people could meet others and where people could be treated or could get busy in a playful way. So it's a complicated society. And there's a tendency of the actual caregivers to be overprotective, to help people even if they could still do things themselves, which actually is supposed to be good. It's supposed to be good for people with Alzheimer to keep them busy, to keep them mentally and physically active. But if you think, just sit down, we will take care for you, you in fact prevent all the type of behavior that would help them to be aware. Another challenge is that the actual caregivers, which in many cases are family members, spend so much time that they really, because of that, only are isolated. So this is a long list of challenges. I'm just going to show you some examples that I picked from the British government documents. And the examples are, again, a technique. Giving examples in this case is a technique. So this is a technique that you need to use for your own design exercise, starting 2 weeks from now. these are in fact descriptions of people you are talking about. So I'm going to give you 4 examples, 4 or 5, I forgot, of people who are diagnosed with Alzheimer, and I'm describing their current situation. If you are going to design, suppose you are going to design for a bed and breakfast company maybe, then you have to give examples of people that would be customers of the bed and breakfast, right? So, it's this. Somebody is trying to call, which means I am on the internet, right? That's the good news. So, this is an example of, and each of you, or sorry, each of the groups will have to come up with examples. Actually, we will later label them persona. And next week, when you are working with Selena, one of your exercises will be to go to a certain website where I explain in detail how to handle persona. By the way, anybody of you knowing what persona would mean in this case? It's a technique. Well, let me explain. A persona is, let me say, a prototypical person that could be. So, for instance, if I would give a persona of students, university students, I would say one type of university student is a student who already has its own design company, and he is studying in the Faculty of Architecture, and he spent about 20 hours a week on his university work and another 20 hours on his own business, and he is single, and he is living in an apartment because his parents' home is too far away, and. So I'm describing a typical person. And maybe it fits more or less some of you, but I'm not describing an actual living person, but somebody that you could also imagine say, I know somebody like that. So that's a persona. And then I could describe another student, which is maybe an exchange student. He's coming from another country, and he is just here for 1 year to do some classes and to write a thesis. And this student is far from his home, and he's living in a hotel, and so I'm describing another type of student, and you could say, yes, we know some people like that. Okay? So you can describe certain different types of people, not real people, but a description that is recognizable as one of the types of students that are around. Okay? Good. Now, so for the Alzheimer, so this is Bill. Bill is only 56, which is young in a way. But Bill is, well, he has children who are not too far away. They are living on their own, but it's very close. And Bill found out that his life changed. And he is aware that he is diagnosed with Alzheimer's disease at a very young age, but it happens. And he now find out that he is much more relying on his family because they need to help. And he is telling me that he has a good group of friends. And by the way, with Alzheimer's disease, if people are treated well, you find out they are talking about their friends, which is people that they meet every day or very regularly, and maybe in the past there were just people that they met sometimes, but now for them they are friends because these are the people they recognize and that always are willing to talk to him, and so friends are, in many cases of Alzheimer, are kind of very important things. And don't think these are the friends from school from 30 years ago. This might be the neighbors or somebody in a shop that he is regularly going to buy some bread or whatever. But now they are considered the friends because these are the people they can still talk to and they can recognize. And you can see what was one of the most important things for Bill. It was losing his job. He couldn't remember things and he couldn't work anymore. So, and there was an effect, right? The effect was that because he lost his job, the money went down. And he got a disability allowance, so this is some kind of a state allowance for when you are ill and can't work anymore. And again, the big problem maybe is not so much the money, but missing the people at work. Right? So now we identify some challenges for this person. And the challenges are, I miss people that I can talk to, and on the other hand, I have some people I can talk to, and these are now my friends. Right? So, and also he's doing his hobbies, and the GP, which is the medical doctor, this is what we call it general practitioner in the UK, so this is their home physician, in fact introduced him to some other people with the same type of problems. Well, and you can see there's challenges in the home, in between the partners. Obviously, right? He's much more reliant on his wife, and because he does things that look stupid to everybody, including his wife, she says, you know, right? And so they get some quarrels. Okay. Betty's 80. So this is a different type of age. It's a different type of an Alzheimer case. You can understand, right? I mean, this is a person who really, well, maybe it looks like Alzheimer was diagnosed just 2 years ago. No, 2 years later, so this is after her husband died. So she has been living without any problems, so to speak, up till 72, lost her husband, and then after that. So it's a completely different persona. Right? So it's important to understand that for your case, whatever you are going to design 2 weeks from now, you have to identify really different types of people. People with different types of needs, different types of context, different types of network maybe, but they are all part of the same kind of service needs. So one of your colleague groups last year, they designed for a big hotel here, and they identified that tourist hotel visitors are completely different people from the business hotel visitors. They are different personas, they get a completely different description because they have different needs, they have different knowledge, they have a different goal, they want to communicate in a different way. So this is Betty, and she felt isolated, and she didn't have family. So if you are young, there's a bigger chance you have family. So in the first persona, Bill, he had a wife and his children were 15 minutes away. Betty's husband, he died, and there's nobody around. So she felt lonely, right? And she was actually walking around to look for her old home. So she got really lost. Nobody could help her, and she was maybe actually walking in the street. And now she attends a club. And you can see that attending a club makes a lot of sense. So now she got her friends in a way, right? And actually even other people find out it helps, right? No longer being completely left on your own, which with Alzheimer could mean that you are going to walk around to find things. You are not completely sure what you're looking for, but you are. But actually walking in the streets, I've seen this. So people who are walking in the streets trying to find their home, their previous home. And now she has a club, which means that she has now a location where she can find other people to talk to. And it looks like other people identify you are doing better now.